Hepatitis C is a disease that sometimes doesn't present any symptoms until 20 to 30 years after exposure to the virus. And there is a lot of misinformation out there about this disease. And the folks at the Mountain Home VA healthcare system are trying to educate veterans and the public at large about hepatitis C. And joining us this morning to discuss the issues surrounding this disease are Ashley Smith and Penny Thayer. Thank you, ladies, for being here.
Thank you.
Let's talk about this. This is just a there's a lot of stuff out there. I mean, we see hepatitis C commercials for cures and pills and things of that nature. Why are y'all doing this?
Our first goal is to educate people that hepatitis C is a virus that you get from blood-to-blood contact. Right. Lots of different signs. There's no really symptoms, but there are different misconceptions that you have to be an IV drug user, an alcoholic to have hepatitis C, and that simply isn't true. There's about 4 million people in the United States that have hepatitis C, but only about 3 out of 4 of those actually know that they have it. So that leaves about 600,000 people in the US that do not know that they have it because there are no symptoms and you don't have to have what they call an identifiable risk factor.
There's a lot of people that may be at risk that don't even know they're at risk. Is that true?
Yes.
Talk to us about why is that situation the way it is?
The CDC came out about 1.5 years ago with what they call a birth cohort, or a group of patients born between 1945 and 1965 that are 5 times more likely to have hepatitis C than the general population. Why we don't know, that really isn't sure. It could be due to infection control practices that were not in effect in the 60s and 70s. It could be people don't want to talk about the stigma of hepatitis C. So we're trying to educate people to just come out and get tested and get screened because we do have cures now. And
you were talking about stigma. I mean, a lot of people think you're absolutely a drug user or something along those lines if you have hepatitis C, and that's really not the case, is it?
Correct, right. That's absolutely not true. There are a lot of other things, like Ms. Thayer mentioned, just being born between 1945 and 1965 is a risk factor that you should be screened at least once. Other things to consider: if you've ever had tattoos or piercings, possibly, if you've ever had dialysis or a blood transfusion before 1992, since we didn't have the ability to screen very well for that. Also, if you ever shared personal hygiene items such as razors or toothbrushes with someone who is infected, that could also be a risk factor for you and a reason to get screened.
Right. And I was going to say, who should get screened? I mean, is if you were born in those years, should you go out and get screened? I mean, just better safe than sorry.
Yes, and the screening test is very simple. It's just a simple blood test, and that's a screening test. So if it's positive, there is a confirmatory test that must be done to actually confirm that you have hepatitis C. Right. So the screening is just very simple.
All right, very good. And there are treatments. If you do find out that you got hepatitis C, there are treatments. Tell us about the treatments that are available.
And that's definitely one thing we want to highlight as well. We have new medications available that have a 95% cure rate. So they're very successful. Most patients are going to be taking 1 pill once a day for 12 weeks, and that should get rid of their virus. You won't be you'll be cured, but you won't be immune. So you do need to be aware of that. But so far, we have been able to use these new medications in over 60,000 veterans nationwide.
Wow, great. And getting good results.
Yes, that success rate has been substantiated.
All right. What tips do you want folks to leave here today at home viewing this right now? What do you want them to take away from this? What tips do you offer them?
One, we recommend that everyone get screened, get treated, and get cured. That's a national push awareness. If you are a veteran, we do have a program that we're open, we're easily accessible. Call your primary care provider, get screened. If you need us, we're there. If you're in the community, contact your primary care provider, or you can contact the health department to get a screening.
All right, ladies, thank you so much. Great information for our viewers out there.
Thank you.
Folks, there is plenty of information to be had at those numbers and that website right there at the bottom of the screen. If you need to get tested, take care of that today.